Welcome, Lysander Jim, to Coaching in Session. How are you doing today?
I'm doing well. Thanks for having me.
Of course, today I have you on as a spine doctor. First time on Coaching in Session that we have a specialty like yours. And I am so excited to have a conversation with you because we are going to be talking about back health. And we're going to be talking about something that people don't really recognize until they're maybe in their late 50s, 60s, and they're hunched over and they're having a hard time walking from here and there. And there are going to be things that people can be doing to make sure that their back is in the best health and maybe even give some tips and tricks for people at the end of this so they can start to implement them today rather than try to fix it later on in life. But without me telling your whole backstory, please tell the world who you are, what you do, and how you help.
Well, I'm a spine doctor. I also treat immune conditions in my clinic in California. And my passion around back pain started around the time I read a book called Low Back Disorders by Professor Stuart McGill. In the book, he talked about how biomechanics, which is your posture, your movements, your activities, affect how back pain starts and how back pain continues. And that by modifying those and other factors, many people who are stuck in chronic pain can be helped.
When we look at the biomechanics of the past, are they different than what you're experiencing today?
That's a great question. I mean, if we're talking about why a back injury started, it's usually from what's called cumulative forces. So that means there's all this past stuff that has happened that led to the injury. Maybe analogous to getting a heart attack. It's not because you ran on the treadmill today that you got it. It was a lot of stress or diet, inflammation that happened in your body. And that's similar with many cases of back injury. And connecting that to the present day, that's kind of the linchpin in all of this is how you continue to carry yourself, move, and the exercises you choose or don't choose are keeping you potentially in pain.
Interesting. Because if we look back at, let's say, 60s, 70s, we had workers going out, heavy construction, and maybe eventually they would have some back pains. But today we have a very easier life or a much easier life than the construction workers of the past. Not saying construction workers today have it any easier, but we do have better technology, better machinery. But a good majority of people, they work from home. And so they're sitting all day, they're maybe laying down more because, again, they're working from home. It's easier. The pandemic didn't make it any easier on people, but yet many young individuals, they're having more back pains or sciatica issues. Do you think it's because of our habits or is it because of just genetics?
Genetics plays a partial role in developing back pain, but I think that the paradox you're touching on is there's this belief that loading and overloading causes pain. So now we have a whole generation that is effectively underloaded, like they're sedentary and they still have high levels of pain. And the reason this could be in part is being moving too little. I mean, it's almost like think about the development of knee arthritis. If you move too little, will that keep you from getting knee arthritis when you're older? It's actually not true. It actually will. You can create an injury much faster if you're trying to run 100 miles every single week. But then under conditioning, under training is actually a risk factor too. So your discs are weaker, your muscles aren't toned, and you also have no movement skill and wisdom. So I can sit here in a chair all day and I can get a bad case of back pain, or I can get the flu or COVID and lay in bed all day. And many people develop back pain from being sedentary. So I think that moving too little is dangerous and moving too much is dangerous too, in terms of muscle and joint health.
The last thing I want to kind of just present to the audience before we really get into the conversation is how we are situated, like our body posture. So, for example, I'm sure you might have seen it maybe just, walking in the streets of California. Maybe you go for a hike, you see people kind of looking down on their phone like this, and they're not in a correct posture. They're slouched, and then that becomes their normal way of walking. So when they walk into a grocery store, they're looking down. Maybe even if they don't have their phone, it's almost like they get stuck there. Do you find that to be common?
Yes, I mean, the what you're describing is maybe the neck is flexed all the time, the spine's rounded, and there's even a loss of awareness of not just the physical body, but the general environment. And yes, that is a risk factor for developing back pain because the back and the spine, it thrives usually with the right combination of movement and activity, and also the right combination of how the person holds themselves. And usually there's a sweet spot that's known as neutral, where the head is more or less level, and then the spine is in a position where the discs, ligaments, and muscles are, they're not stretched and they're not really bent one way or the other either. If we're having these lifestyles where our shoulders are rounded in front of our computers, we look down on the phone, then those factors, you're going to have an overload of bad posture, and then you're going to slowly kind of wear down. The disc is probably the first part that will wear down, but other injuries can develop from that as well.
Okay, great. And let's start to look at the healing process. So let's say someone comes to you with back pain, let's say lower back pain, just to kind of give it a more specific answer. They have a lower back pain and they say that they have been experiencing this for years and they've been taking just medicine to kind of cope with it. What would be some of the things you do first for this individual to help them relieve some of that pain and then to heal that pain so it's not going to be there for the rest of their life?
First, I would observe and see what their patterns of posture, their patterns of movement. I would talk to them about their lifestyle. And now that gives you a certain picture. So maybe for your listeners, it would be helpful to give a specific case, for example. So let's say there's a gentleman who's in his 60s now, and he says, "Oh, when I was in my 20s, I was a smoke jumper, worked as a firefighter." And so right off the bat, you think, oh, this person, his spine has probably taken a few jolts. He's had an adventurous life. And then I would do, physical exam. And what that process, this clinical assessment is intended to do is to determine what the pattern is. And one of the key aspects of it is what are the patterns of postures, movements, activities that create the pain? And what is the kind of pain? Is it the back? Is it the leg? Is it both? In some rare cases, we see patients who also have bladder and bowel symptoms. Maybe they're incontinent or have, erectile dysfunction. Depending on what signs I'm picking up and reviewing the spinal imaging, that's going to tell me, hopefully, the anatomic diagnosis and also the functional diagnosis. So let's say that particular gentleman, his spine was very kind of crusty and arthritic, and he struggled to stand up tall now. But he kept trying to force that pattern that was keeping him in pain unwittingly. When you know what causes the pain, then you can, in most cases, engineer it out with better posture, better movement, better tactics. One tactic is, hey, I want to walk 3 miles every morning, but I start hurting after a mile. Well, maybe the tactic there is, why don't you just walk half a mile, 3/4 of a mile, take a break, and maybe at lunchtime, do that again. Now, suddenly you've patched together a mile that's pain-free. And then kind of the last part of that is potentially exercise. So your standard patient won't need an injection, won't necessarily need a surgery. And then you can give them what is in effect a physical therapy plan that's informed by the medical diagnosis to solve the problem.
No, that's well said and easy to understand too. When we look at the perfect mix, because you said that you can be overly worked out if you run 100 miles every day, or you could be underworked out if you don't do anything. You just stay at home and lay in bed, and it could be underworked out. When a person goes into therapy, they work with someone, doctor, therapist, to get their body back on track. Do you find that people today are just, I don't want to say ignorant, but it is the best word for it, or just maybe unknowingly not doing the right things for the body? It's almost like they weren't taught it in school or maybe from their parents. So they just kind of go with the ebb and flow of life. And then they find themselves in a situation later on where they do have these pains, maybe in their elbows, their knees, or their back.
Yes, there is definitely a lack of quality information because I'm fortunate to see they've worked with often many other clinicians and therapists. Sometimes the individual has not received the correct information or the correct instruction. I mean, one main example I can give is, let's say a person has a particular so-called pain trigger. Their back hurts from rounding forward. if you know that about this patient, you wouldn't design an exercise and rehab program that features, very much bending forward, especially under load. But then you'll see the exercise program, which sometimes is just a printout. It wasn't really individualized for the patient. It was more individualized for a disease category like disc bulge. And then the thought is if the patient was in fact the same before, had this bending intolerance, and were given an exercise that replicated the injury mechanism that reproduced their usual, let's say shooting leg pain, then you'd think that design wasn't really considered from the ground up. So I think that that's one of the big mistakes we see is if you don't consider each injury from the ground up, and that's not just the injury mechanisms, it can also be other parts of the body. Like let's say somebody has a knee pain and then you're having them do a kneeling kind of squat pattern. You're putting a lot of pressure on their knees. They really shouldn't be doing that exercise. So you have to kind of consider the whole person. And the main things we look at is primary spine injury, other associated injuries, safety. Like you probably wouldn't load an 80-year-old too much, under like a squat rack or something. You look at gender, you look at their body type. Some people are big and strong, and you can give them heavy loads if their spine and other parts of their body up for it. Other people, they're more endurable. That strong person, you have them walk up and down your hall, they're beet red and they're huffing and puffing. They might have hypertension. How do you build that person up is very different from somebody who's like whippet skinny. They could, they run 10 miles a day, almost every day. And so you kind of use these kind of factors to inform how you're going to help them heal.
Yes, and definitely the individualized stuff is going to be better and more practical for most people who are experiencing pain. One of the things I want to share with people today is almost like an educational pamphlet in the sense of a conversation, a podcast conversation, of course, is what this is. This is an educational insert for people to say, oh, let me start to pay attention. Because if a parent is listening to this, they can say, oh, maybe introduce some spine health or some type of body health for my child because I want them to grow up and they could be 65 running around. And that is just going to be the level of education that someone gets. Because if they're never told or talked to about health, be it body or mind, as they grow up, they're going to fall into this circumstance that they're doing these poor habit choices of maybe lack of movement or doing the wrong movement, or if they feel like their back is hurting, they have to stretch it more, so they're doing things that might enhance the pain in order to get rid of the pain, but that can be from bad information that they receive. And have found in my years of teaching that we don't really do the best job at teaching education to the youth, health education. It's almost like, all right, we teach you the basic, the curriculum, your reading, your writing, your math, and it's up to the gym teacher to give a little bit of information. But the gym teacher only sees them maybe 1 or 2 times a week. And so they have a very limited amount of time of movement in the classroom, besides walking to the bathroom, getting up and going in line. And then they have their recess for about 20 to 30 minutes. Is that enough time, especially a growing child, to be moving? Because if we look at the school system, and you're in California, so I'm not sure if you're too familiar with the school system there, but the amount of time that is regulated for play and academics, is that a good mix for a child that's growing?
Well, I think that, certainly the standard curriculum. I have a 10-year-old in the public school system, and it's last year the school had a program where several times a week the children would be encouraged to run a mile. And I don't know exactly why, but this year that program has been banned. And I was disappointed. I mean, I'm not sure it's a great idea that every kid runs a mile. It might be too much for a lot of the children who are, you're taking some very deconditioned, out of shape children, and just running, you can certainly create problems. But I think that it was the idea of more movement was a move in the right direction. And so what do we do about that? Now my son, he goes to jujitsu a couple times a week. We go climbing, some days we try to take a walk, do a little walking or running before school. And when we run, by the way, he's only 10. I'm not really running him a mile. He might run 100 meters 3, 4 times. And for both of us, it's a transformative way to start the day. So I think to answer your question, yeah, it's not, there's a lot of things that school maybe ought to teach, and it's a kind of a common social media topic. Should school teach us about movement and posture? Or usually people talk about should teach us about taxes, or human relationships and psychology. I mean, the school system is largely, I find that the teachers are, we've had the luck of having a lot of good teachers, but they're teaching a curriculum, and then there are these basic skills. So I would say it's really on the family's responsibility, I find, to try to create that environment or that encouragement, because we can definitely, myself or my family, you could easily drift into sedentary lifestyle. Like most of California, we can't really walk to the school. We can't even walk in the area around the school. It's not that there's a lot of traffic, but closer to where we live, can we take a walk and then drive over? And just building in these kind of habits. I do think there's this huge deficiency in movement and quality movement in general. But just to start, if people just walked to school, I mean, that would be transformative if that's possible. So I don't know about you, but if I don't get some activity in, it's hard for me to stay present and focus and read. And then I'm not having to sit there for many hours a day anymore, having gone through this, a lot of education to get where I am.
Yes, I stand with you on that. The first thing I do in the morning or when I wake up, it's like gym. I have to get going. And it's not even so much about like lifting heavy weights and getting the muscle. It's about just having the action and moving. I can walk on the treadmill, maybe a steady state incline. I could do a little bit of Stairmaster, lift some weights and do some pull ups, push ups, planks, things along those lines. It's all about moving for me. I want to get into the gym and move because most people who fall into depression, they don't realize that one of the reasons they fall into depression so deeply and so quickly is because they start to mitigate their movement, meaning they stop doing as much movements. For example, someone who is typically depressed, maybe going through a hard moment in their life, they lost a job, a loved one, whatever it be. They might sit in their room or home on the sofa watching TV, whatever, but they sit still. And eventually, if you have someone wonderful in your life, a friend, a family member that comes in the house and says, "When's the last time you took a bath? When's the last time you left the house?" And then they get them out of that situation and get them moving. And from there, they start to repair or fix or get out of the depression because they started moving. And moving has such a powerful impact. As you said, one of the things I think the school was trying to do was implement more moving for the students. I'm sure there was probably some type of problem with staffing it. Maybe teachers didn't want to do the walks anymore. We don't have the staff to do this, so we can't facilitate it for the children. And it's sad because it is going to be dependent on the parent to make sure that their kids are in some type of extracurricular activity, be it a sport, a martial art, doing things together, going to the park, doing those sprints, doing walks just around the track. That can create a lifestyle that's going to help adults when they are finally older be more conscious of how their body's operating. I'm not sure if you have heard this before, but typically someone might reach 45, 50 years old and their back starts to hurt. And they say, "Oh, my back is hurting because I'm old." Do you think there's some truth behind that logic of someone just saying, "I'm 50 and I'm old and my back hurts"? Like, are you supposed to be 50 and your back hurts? Or is that a fallacy?
I don't find that it's age dependent. I mean, typically back pain doesn't affect children as much. I mean, oftentimes, early onset back pain in children usually can indicate some big injury or a bigger problem. But usually from kind of start of young adulthood, 20s, we have patients in their 20s, 30s who have back pain. It strikes often well before middle age. But I mean, I think your question was kind of getting at, is kind of back pain an inevitable part of life? Because I think some of the stats will point, it varies, but they'll say, well, at some point in your life, at least 80% of people are going to develop, some episode of back pain. I would say that for some people, can be an inevitable in some people, but I think that, let's say you could create this test tube condition where the person got the right amount of exercise, they never fell on their back, there's all these different factors. They had great posture. They got to move the right amount. They weren't forced to be overly sedentary for work or home life. Then you can go through your life with minimal episodes of back pain. Save the odd kind of injury where you kind of tweak it, lifting furniture. But if you're in great physical condition though, and you have, good lifting form and you're sensible in what you put yourself under, then you can stay pain-free. But I think there's a lot of those kind of situations where they'll say, oh, if you're not flexible, then you'll develop back pain for sure. I mean, people would tell me that because I'm not a very flexible person. And they would say, oh, you're going to definitely develop back pain. And then if some of these are actually myths, like it's actually not true that if you're inflexible that you'll necessarily develop back pain. I think if you're inflexible and you try to overstretch or like reach beyond your means, then yeah, you're at risk for certain activities. But if you kind of stay within your envelope of safety, and for range of motion, for loading, that's different for each of us. Like I know if I lift beyond my capacity, I'll probably get some pain, or if I twist and move beyond my capacity. But if I stay in my range, which fortunately right now is pretty broad, then I'll be okay.
I have some friends who suffer from back pains, and it's almost like a spasm every, change of season. So like in the fall, they'll get a back pain, it seems like, and they like can't move. They're just literally bedridden. And they take these muscle relaxers, but I don't think they speak with a spine doctor or a specialist. I think they just get them from their regular physician. Do you think it's a good idea if you're going through something along those lines where you're having an immense amount of pain to see a specialist rather than just your regular family physician?
I think the family physician is a good place to start, but if the issue isn't resolving, it makes sense to escalate the level of care to the best specialist that you can see. I started off my career as a pain medicine doctor, and prescribing a muscle relaxer, an anti-inflammatory, and opioid. That was the main thing I did in that original practice. And it doesn't fix the underlying problem. It provides symptomatic relief. Some would say it's a band-aid approach. And I certainly found it not satisfying to just put a band-aid on it, especially when you consider the risks of these different medications. And then it was through learning the McGill method and figuring out, well, there is a way to treat it, but you have to be thorough in your assessment, kind of precise in your diagnosis, and kind of skilled in your coaching in order for it to work.
No, that makes sense because I know some people will take the drug before they do the work because therapy can be painful and it can be scary because people don't want to go through that hard moment in their life where they have to struggle through the pain. I know many people who try to avoid therapy because they think of their former self quite often. They could walk before and now they can't walk, or they struggle to walk upstairs, or they struggle to bend over and pick up a box that has nothing in it. Mentally, it's a strain on them. It's just like, I don't want to see myself like this. Think of someone who doesn't want to see one of their parents passing away or, like in bed sick because they don't want that image of their parent like that. And sometimes a person gives themselves that image of their healthy virgin self. And now they have to see this person that is healing or should be healing, and they can't come to reason with that. That can be very difficult. When someone is in denial because they look back at their childhood, maybe they look back at when they could do something well, and then now they're at this place of, I need to make a change in my life. What is something you do to help them get through that hard moment in their life?
I start with meeting them where they are. I mean, I try to acknowledge, for any of us, if you could do something or had something before and you lose it, then it's a difficult process, and there's a huge psychological component to rehabilitation and healing. But what I'd like to do is just bring it to the present and say, well, here's where you are. And in some cases, there is a prospect to getting back to your full pre-injury conditions. And sadly, in some cases, you can get better, but you might not get all the way back. It just depends on where the person is. And then I think a lot of it is kind of context. So sometimes people will say, oh, I'm really sad because, my pain is all gone, but I still can't golf yet. And then I kind of just give them some context. I would say, well, if you were in very severe pain before and you have no pain, that's actually a huge victory. And then, of course, you want to build on that and regain function. But usually the first step is you want to wind down, that is, get rid of the pain, and then you build function. and robustness afterward. And we have some general ideas, based on the type of injury and how sick they are, of where they likely can get. But then I always just say, well, if you want to get to, Z, you got to kind of get through a couple of things, and then that will inform how well you're likely to get to this end destination. But it reminds me of this interview I heard with Arnold Schwarzenegger. He's promoting his great book, by the way, Be Useful. And then he's just talking about aging and how his body is not as awesome as it used to be. And he says, well, it's not a big deal for a normal person, because he's like, their bodies were always crappy, but then, but he had this like world-renowned physique. I see that too in my patients. I mean, some of them are or have been so athletic, like they were just killers, like they mixed martial arts, jujitsu when they were young, and now they're 60, 65, and they still want to take out the next generation, right? They're training with 20 and 30-year-olds. And I try to, explain to them about how you modify. I mean, even these like legends, they're still not, they're not competing anymore. And, you have to kind of make that transition. But I think it's a broader thing about accepting kind of life and mortality and decline. I mean, you don't want to like lean into a decline, but then it's almost like there's some things that you would expect. Schwarzenegger isn't going to be as jacked as he was when he was 30 and winning Mr. Olympias. And then that, for him, it takes some coming to terms too. And I can understand for someone like myself, I never had celebrated physique, so I'm not going to stress out, oh, hey, I'm almost 40 now. And then I'm not as cut or big as I was when I was in high school or in college.
No, that makes perfect sense because people who hold themselves to high standards, they keep that mindset with them until later age. You could look at army veterans who just have that battle orientated mindset, even in a nursing home. They're just those reluctant, stubborn individuals, but that's what they needed to have in order to thrive in that situation that they were in. And then we look at the concept of like a runner, for example. I just read the book, How Bad Do You Want It? And it talks about all these runners who would go for first place in their heavy training regiments and things along those lines. And it was this one runner, I forget his name, but he had won the race, I believe, 3 or more times. And eventually he was getting older. He still ran the race, but when the news media asked him, hey, do you plan on winning? He goes, no, I just plan on doing the race, because he knew his limitations. He knew there was younger people who were in a better physique than him, maybe the same strong mindset, and he can bow out, but still do the thing he loved, which was running. And at some level, we have to understand that just because we were this person who could walk and to do all these amazing things, we shouldn't belittle that idea of our former selves. It is who we are, and where we were doesn't have to be where we are today or tomorrow. If you need healing, why not get it, right? If you need some maintenance work on yourself, why not do it? Many people are so quick to ignore it, to say that I don't want to push because it's not going to be the same. People are quick to throw out something that's broken, whether it be relationships or their own health. They see the divide or the gap or the chasm of what they have to do and where they are. So I want to, promote you, because what you do is help people heal from back injuries and help people understand good spine health. But for that to happen, people have to be aware of it. It's not just something that, oh, I woke up and I have back pain. Well, why did that happen? Do you have a bad mattress? Do you have bad habits? All of these things need to be looked at. And I believe your work is not only going to be helping fix people, but also educating people. And I think that's so important in our world today. As we begin to wrap up, I would love for some final words from you, and then to please tell the audience where they can find you.
All right. Well, yeah, thanks for having me. I mean, I think most back pain can be resolved. And, I just hope that, people, if they want additional resources, I have a book I published recently called Specific Spine. And then I have a number of blog articles on my website, masterymedical.com, where they can learn more about a range of common conditions people come into us for.
Perfect. And I'll make it easy. I'll definitely put the book description for people to find, to purchase, and to understand, because again, we're in a technological world where everyone's going to Google for the fix and they're trying all these different things. But I mean, even when I had my car accident 2010, I believe, I went to go see a specialist and it was the best thing for me because I couldn't even do a sit up. It was that bad. And when I was done with my therapy process, trust me, it did not feel good. But after I felt great. And I'm very aware of my back, my spine, my health because of that accident. We can learn to heal. If you are struggling with pain in your life right now, do not sit in it. Do not try to just do the band aid approach. Learn to heal from it. And I think you're going to be a great asset in anyone's corner to get them back to health. I want to thank you so much for coming on, spending some time, and talking about the work that you do.
Hey, it's my pleasure. Thanks for having me.
Of course.